afternoon, everyone. Ms. Amanda Davis, the International Agency for the Prevention of Blindness, IAPB, Regional Chair of the Western Pacific Region. Mr. Drew Keys, the International Agency of the Prevention of Blindness, Program Manager of the Western Pacific Region. Dr. Andreas Müller, Consultant, World Health Organization, Global. Dr. Fabrizio Di Esposito, Consultant, World Health Organization, Non-Communicable Disease, Western Pacific Region Office. Professor Sergei Zresnikov, Visiting Professor, UNSW, and President, Organization for the Prevention of Blindness, France. Dr. Nurfariza Nga, the Head of Ophthalmology Services, Malaysian Ministry of Health. Ms. Jennifer Silbeck, Chair of the IAPB, Gender Equity Working Group. Dr. Meho, Optometrist and Primary Care Advisor, Fred Hollows Foundation, the speakers and the representatives from the member states. The first WHO IAPB meeting on cataract surgery outcomes monitoring system for the Western Pacific region was hosted by Malaysia on 19th to 20th September 2018 at Shah Alam Hospital. This novel meeting of cataract outcomes was co-organized by the International Agency for the Prevention of Blindness and the World Health Organization Regional Office for the Western Pacific. During the meeting, delegates discussed and shared successes and barriers for improving cataract surgery outcomes monitoring programs in their countries, provided information on assisting tools and strategies to monitor cataract surgery outcomes, and develop country-specific action points to strengthen quality assurance cataract surgical services. It has produced constructive recommendations to the member states and WHO IAPB at the end of the meeting. Today's meeting is another initiative by WHO IAPB to follow up on the implementation progress of those recommendations. I believe we have worked tirelessly with all the relevant stakeholders within our country to achieve this improvement and will be shared with other member states today. 1 year following the Shah Alam meeting, we were hit by the COVID-19 pandemic. At the beginning of 2020, most countries in the Western Pacific region struggled to provide primary eye care. Malaysia was not spared. The cataract surgical services ceased to function in most major hospitals at the early part of the pandemic due to the complete lockdowns. It was reopened in phases by the second quarter of 2020. The cataract outreach program to the rural population stopped and has yet to start. Lockdowns, people's fears and anxiety, and the financial impact of the pandemic have resulted in a massive backlog of cataract cases and late presentation of cataracts, predisposing patients to complication and poor surgical outcomes. Cataract surgical services in Malaysia and other member states in the region have witnessed an unprecedented event in eye care history in this region. We will never forget the impact of the pandemic on the eye health system of our countries. Numerous eye care plans could not be executed, and the lockdowns severely hit population access to eye care. But we believe that this should not stop us from monitoring our performance and producing good surgical outcomes in cataract surgeries. There are many challenges that we, as eye care providers, will face during the pandemic and during reopening up cataract surgical services. The only way to do this successfully is to meet the challenges together. Hence, the objectives of the meeting today is achieve an agreement on how to address cataract surgery outcomes beyond the pandemic. But before we can achieve good results, the member states must develop recommendations on the sustainable strategies to overcome cataract surgery backlog by incorporating the concept of integrated people-centered eye care, as detailed in 2019 WHO World Report on Vision. Before I conclude, I wish to thank everyone for tireless efforts in the past 2 years of the pandemic, and I hope you will have productive and fruitful discussion. Stay safe and thank you for your attention.